Real Country 1430 AM and 1073 FM WRDN. I'm Brian Winnekins. Joining us today is Pepin County Health Officer Heidi Stewart. Get an update on the COVID-19 situation. And Heidi, thank you for joining us today. Well, I guess first, earlier in the week, there was the health department came out with a press release on the crisis care type thing that the health department's going into. Can you explain that?
Yeah, I certainly can. It really plays into our current numbers and the current case rate in Pepin County. So back in September of 2020, when the first real surge was happening in the state of Wisconsin and county health departments couldn't keep up and the state couldn't keep up, they kind of went away from the original game plan of contact tracing and disease investigation and switched to this crisis standards of practice, which it's a backup plan. It's the second game plan. It's not the first one. But when you're not fully staffed and you're not able, I shouldn't say that, when the staffing capacity that you have isn't able to keep up, sometimes you need to move on to a different option. And that's essentially what we did this week. We did do this I don't know the date that we went into crisis standards, but it was when our case numbers were super high. And then when case numbers settled down this spring and over the summer, we were kind of able to get back into the routine game plan A. And now this week, we're just at a point again with case numbers. Yesterday specifically, we had 7 new cases come in, and some cases have been in quarantine, so they're not around other people, and there's only a few close contacts. That's really simple. But with how mobile we are today in society and without some of the tools that we had in place a year ago, the number of close contacts per person are fairly high, and it is really, really difficult to be able to reach out. So we have to depend on those people that are positive to reach out to their close contacts. We have to depend on some of our key partners, which are schools, employers, assisted livings, in other communities that can be nursing homes. It can be in other communities, university systems, to do some of that. It's not us passing the buck. It's not us, kicking the can down the road. It's us asking for help from others. So that's really where we're at.
And so if, let's say, I'm positive then, and I let the health department, is notified, then I'll get the forms and all of that so that I can notify my close contacts?
Yep. So that is available on the website. So anybody could go check it out now and see kind of what it says. It is a Wisconsin Department of Health Services form, and it outlines I'm positive. Now what do I do? And then there's a handout there as for the positive individual to provide to their close contacts. We're still going to do things like working with people, to help identify close contacts in unique situations. If an individual during our disease investigation says, like we did recently, I was at this establishment or I participated in this event, we'll still continue to do those public notices and keep people up to date and as educated as possible about situations happening. But our case rate for the last 7 days is 178 per 100,000. That's a lot. That's a lot of positives, and we're seeing more and more people with symptoms. The good news continues to be that, the hospitalizations are very minimal, and we're not seeing any deaths during this wave. So that is the really, really good news. I get a lot of questions about the breakthrough vaccines. I think last week I reported that we were around 14%. Our cases this week, we had a few additional cases come through that were fully vaccinated. So I pulled that number today to see. So out of 77 cases, 14%, no, not 14, that was last week. Out of 77 cases since mid-July, which we're considering that this current wave, 19.5% are breakthrough. So that's about 20%.
Now, how does that, and you may not even have that answer, but how does that compare to like the flu? Is that about average? Because, there's a flu vaccine, but some people get a flu shot and they get the flu.
Yeah, I myself was one of those people. I typically get the flu shot every year. And I believe it was 2 years ago, I did get influenza and it was not fun. So I don't know. I don't have that data. I certainly can get that for you. I can pull it up. But breakthrough does happen because specifically with influenza, there are so many different strains. And each year in the influenza vaccine, they do their best guess on what strain is going to be predominant in the community during our influenza season. And that's what the manufacturers go by to make that vaccine. So, if they're not on with creation of that, there can be breakthrough with other strains of that. Speaking of influenza vaccine, I got an email today saying that they were going to soon be shipping our supply for Mass Clinic, which we typically work with the schools to do those influenza vaccines. So that is something else that's coming right up, and it'll be here before we know it. And we'll have to develop a strategy to go ahead and make sure we're getting those influenza vaccines out at the same time as we're continuing our COVID vaccines. Just in case there's a question related to that, we'll be working to post something on our Facebook page as well. But you can receive the influenza vaccine at the same time as receiving the COVID vaccine. That's a question that we get sometimes. We did post information on the Facebook page this week about the additional doses. We posted information on the Facebook page about the booster doses, or what we're hearing about booster doses. Another update around vaccine that I would like to make sure everybody's aware of, there is a shortage right now of the Johnson & Johnson vaccine. So until that manufacturer ships more vaccine to the state of Wisconsin, we are out. We opened our last vial yesterday and gave our last few doses of Johnson & Johnson. So right now the health department only has the Moderna and the Pfizer.
Talking with Pepin County Health Officer Heidi Stewart today. Heidi, have you seen vaccination rates starting to creep back up again? I know that there's been some reports nationwide that that's happening. Is it happening here in Pepin County?
Yeah, so the first surge where we had a bunch of people and we were doing mass clinics was really large, and then it tapered down, and then it kind of tapered back up again. And that has remained fairly steady throughout. So if you go to the Wisconsin Department of Health Services webpage on vaccine data, you can click on Pepin County there, and you'll see that, we're continuing to have a steady number of people vaccinated in Pepin County each week. The state is using some different tactics to try to encourage different people to get vaccinated. They were offering a stipend to individuals of $100 to offset costs and maybe some inconveniences that they would have around getting the vaccine. I read an article earlier this week that 27,000 people had already taken up that opportunity. So that's a big chunk of Wisconsin individuals. I don't know here. We don't we provide the vaccine, but then we don't follow up to see who's doing that within Pepin County. But those types of things are happening. And now that Pfizer is fully approved, we might see a jump in numbers.
All right. Well, Heidi, again, we appreciate you joining us.
Thanks so much, Brian.
Pepin County Health Officer Heidi Stewart, you're listening to Real Country 1430 AM and 107.3 FM WRDN.